with all of your continued indulgences, I want to give Mr. Davis just a couple more minutes to come from voting before we start. The committee will come to order. This is a hearing on waste, abuse, and mismanagement in government health care. And again, on behalf of the witnesses and other interested folks here, thank you for your indulgence for all of us as we had to go vote. The Oversight Committee mission statement is as follows. We exist to secure two fundamental principles. First, Americans have a right to know that the money Washington takes from them is being well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers because taxpayers have a right to know what they get from their government. We will work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the federal bureaucracy. This is the mission of Oversight and Government Reform. I will now recognize myself and then the gentleman from Illinois and the gentleman from Arizona for opening statements. Again, I want to thank our distinguished eclectic group of witnesses for offering what I'm sure is going to be wonderful insight and testimony. Congress all too often deals in abstracts, issuing directives with broad scope and limited specificity. In other words, we pass big ideas and then leave the details to unelected individuals who sometimes escape the scrutiny that comes with popular elections, thereby abdicating our constitutional role. However, this malady in the past has not been limited to our lawmaking responsibility. It has also extended into Congress's role to hold agencies accountable for glaring inefficiencies. Hopefully, we are beginning to recapture that role, and in doing so, rein in an overextended bureaucracy fraught with mismanagement and abuse. Here on the Oversight Committee, it is our duty to ask fair questions and demand honest answers, answers whose validity the American people for too long have been conditioned to doubt. At a time when the approval of Congress is historically and empirically abysmal, this committee has a unique opportunity to begin the arduous process of re-inspiring trust in the institutions of government. That process begins with rooting out areas of waste, nowhere more prevalent than in government health care. The American people expect government to be responsible stewards of taxpayer dollars and devoted practitioners of honest introspection. However, in the areas of Medicare and Medicaid, we have utterly failed in both regards. In the past, Oversight has followed a basic path. We identify a broken program, seek to expose the underlying cracks in its foundation, and explore possible avenues to rectify the problems. We ask why, what are the root causes, and what can be done to fix the problem. In this case, however, many of those questions have already been asked and answered, and yet nothing has been accomplished. Since 1990, GAO has identified both Medicare and Medicaid as high-risk programs, highlighting a path that is fiscally unsustainable over the long term. The GAO also found pervasive internal control deficiencies that put billions of taxpayer dollars at risk of improper payments or waste. From delaying the implementation of HGLIS accounting system to ignoring GAO recommendations designed to address improper payment vulnerabilities, CMS has repeatedly failed to properly confront these financial failures, a burden that falls not on the federal bureaucrats tasked with enacting these reforms, but on American taxpayers across the country. Both Medicare and Medicaid are in desperate need of fundamental, wholesale, systemic reform. They serve as two principal drivers of our crippling burden of debt at a time when economic uncertainty threatens our nation's fiscal security. Something simply has to be done. However, full-scale reform is not the purpose of this hearing. We're seeking to identify areas of inefficiency and determine why common-sense recommendations calculated to decrease exorbitant costs have continuously been ignored. Trust must be earned, and addressing mistakes of the past is an important first step in that process. The American people expect that when money is spent, it is spent properly, and when areas of mismanagement are discovered, they are promptly and adequately corrected. However, recent failures have left them frustrated at the persistent waste, frustrated with the lack of remedy, consequence, and accountability, frustrated by a problem that is so illustrative of a broken, wasteful federal bureaucracy. Today, I hope we can begin the process of addressing that frustration and begin to rebuild citizens' trust in the institutions of government. And